Okay, I see that we have 64 participants in the session at this point. So we'll get started. Good afternoon, and thank you for joining us for the session on positive parenting for clinicians. This is in the developmental challenges track today. And we are really looking forward to the great information that will be coming forth in this session. I have a few logistical notes to make before we start. This session is being recorded. The chat is being archived. All of the participants are in what's called the view only mode, as the other sessions were earlier today as well. So you cannot use your microphone. You will be encouraged to use the chat box at any time in the session to pose a question. If there's a technical issue that comes up, you can certainly put it there too. I believe that our presenters are going to have a section where our participation is particularly encouraged, and any questions that aren't addressed during that time we'll bring up at the end of the session. This session does use auto captioning, so these captions aren't perfect, but we hope they improve accessibility for all attendees. If you want to activate this, just look for the option on your toolbar that says live transcript and select either the subtitles or the full transcript, and you'll see it in a sidebar. If you are intending to claim professional development credit through the South Carolina Endeavors for early educators for attending this, it's important that you complete the submission form, and that is shared in the chat box with the link. I will be posting that again at the end of the session. You would need to attend the full session in order to receive that credit, and you'd need to fill out the form, I believe, before the session ends or right at the end. So at this point, I'm totally pleased to introduce the speakers. We have Dr. Tony Whitaker, who is a professor of pediatrics at the University of Tennessee Health Sciences Center and the division chief for developmental pediatrics at the, and I'm probably going to mispronounce that, I'll let you correct it, Le Bonheur Children's Hospital. We also have Dr. Alexandra Vose, who's assistant professor in the Department of Pediatrics, Division of Developmental Pediatrics at the University of Tennessee Health Sciences Center, College of Medicine. Welcome to you both, and the show is yours.
Thank you, David. Hi, everyone. I'm Tony. Nice to meet you all virtually. I hope we will get some chats in the chat box. We do have one little bit of interactive spot, and we're happy to take questions, of course. And David, you did a fine job with the pronunciation for the hospital. You probably did better French than the rest of us. Le Bonheur, we call it, Le Bonheur Children's Hospital in Memphis. Thank you all for coming. We're very excited to talk about this topic. Dr. Vose and I are fairly passionate about the topic, and I was so glad to hear Dr. Klass's presentation this morning for the keynote. And I was happy that we mirrored a lot of what she had said about positive parenting and things we can do. It's always good to have like minds. I think some of the chats were about, we're singing the same song. So I think a lot of those in the audience will be also people who are already singing this song. I know at a conference called Nurturing Developing Minds, we all have probably very similar goals. Our focus for this talk was to think a little bit more about, as clinicians, not how we can do therapy or give behavior management advice directly, how we can really incorporate a lot of those positive parenting strategies, modeling, and all sorts of ways we can just exude positive things for families while we're with them. So not directly as therapy or counseling or behavior management, but in the ways we interact. And so I envision this not as I'm a developmental pediatrician, I do give such counseling. Dr. Vose is a psychologist. She does give such counseling directly to parents. But in thinking about the broader sense of professionals that interact with kids and families, how we can just in our everyday quick interactions that we have with these families, embody those things that we think might be carried down the line a bit. And I bet many of you are already doing a lot of these things. We do not pretend that we are the only experts. We are happy to hear from the chat box some other ideas you have. We have some specific examples of just sort of clinical things. The first version I did of this talk was meant for pediatric residents, so physicians in training and medical students primarily. And I have adjusted the examples a little bit to think more broadly across multiple professions, but I hope you can see a little bit of yourself, even in the examples that may still be a little medical, and certainly feel free to give us some more examples along the way. It's just to get us thinking about the little things, I hope. Next slide. Our objectives are to connect positively with parents, encourage families to consider their own positive approaches to child development, and we'll come a little bit more specifically to development as we go, and behavior. We will share some parenting resources that we've curated. However, this is not meant to be all of them, or a few good and often free examples. We don't have financial disclosures for this talk. Next slide. And as I mentioned, we want to think about today the sort of transferable tips to families, ways we can behave that are positive with the families, but also things that the families can take from us and go to their everyday lives. It ultimately also helps us with better care, whether you're a medical provider as I am, or another type of professional. Those positive connections with the family, the child, and the parents can make it so much easier to do your job. So I often think of this also as sort of a time saver and a saver of all things that are making our relationship work when I think of helping the families think these things through. Next slide. So again, back to Dr. Klass's talk and some other talks we've heard today. This is sort of old news for this group probably, but I'll repeat it because it's so important. And we'll actually end up repeating a few other things, Dr. Vose and I, as we walk through some of the steps we've put together, but they're important. We know you know it, but we want to think about specifically how to convey that. So kids need safe, stable, nurturing, positive relationships, and they need this in environments that allow them to thrive. I was so glad to hear Dr. Klass this morning reference the flourishing index. As we get more aware and willing to talk more about how we help kids thrive and become themselves as they do it, we have national measures, people more interested, research ongoing to think about this flourishing that we want all of our citizens to do, but it has to start in childhood. So these sorts of concepts really get kids to where they can be those thriving and flourishing adults eventually. And we can help parents understand and provide those essentials. Parents need support in developing those skills. It's not something everybody necessarily learns the same way as they're growing up. So while I sometimes think, well, this is pretty basic concept that you need to be positive with kids, not everybody comes from that same place originally, but we can help share easy ways and then more complex as we're able, how parents can get there as well. And building those skills in parents helps them support their own kids' development better. And to me, development in this case means development of specific skills, but also means development of emotions and coping and how they approach life from there on out. And I will add a note. Dr. Klass also mentioned adverse childhood experiences or children with developmental special needs or other special needs. We won't talk a lot about that in this session, but do think as we go about kids and families who may need extra help or encouragement along the way. It's super easy to have a family who just jumps right in and yeah, that's great. Let's do that. I'm gonna do that every day. But that's maybe a luxury. So we need to think about those who may need to come to it a little more slowly or need a little bit more specific, either nudges to start or specific advice on how to make it happen. Some of those folks who may need a little extra help, certainly not a limited list here, but parents who may have experienced themselves maltreatment during childhood, that doesn't always come out instantly, but it's something to think about. Parents who don't have as many supports or kind of struggling to make ends meet. And this past year has been especially hard. Again, Dr. Klass mentioned parents were already doing so much. And in the era of COVID, we really needed parents to do so many more things. So think about those who really were maybe on the edge of their supports in the first place and how we can support that better. And children themselves who have certain developmental behavioral challenges will take some extra energy as we help those parents. And who else can you think about? Just keep in mind the folks that you may see as we go through. Next slide. I put up some words. I loved making this, actually. I weighted some words, put up some words myself of some words I think are positive and meaningful to me as words I like to think about as I go through my day-to-day life, words I'd like my kids to think about as they go through their day-to-day life. Each person's word cloud would be different, but what we will say many times today is the words you choose really matter. So a quick interaction with a family, if a word that's not as positive takes the place where a really positive word could be, you've maybe missed an opportunity. So I think every day I have missed an opportunity with someone when I could have picked a more positive word, but I try again the next day. So maybe that will be determination for me. So think as we go, what words you may use already that are already very positive, and keep those going. Next slide. Parents matter. Just a shout out to parents being the experts for their own kids. No matter where they come from, what their education level, who they know, what they've done today, they're the people that know those kids the best, and they already have so much insight into what those kids are doing. They may need some help in how to interpret certain things, interpret behaviors, or they may need help knowing exactly what to do, or some expert guidance along the way, but they really are the experts for those kids. And the sooner we, the professionals, embrace that, the better, and the sooner we can help them from there. Parents are often highly motivated. Parents from all backgrounds agree that they can learn more skills. Every day I see people clinically, I feel like I have this conversation that we can always build, and that includes the professionals and myself. Most parents wish they had more information, good information on how to get better. Most parents say if they knew more positive parenting strategies, they would use them. Parents don't always agree with my recommendations or your recommendations, and there may be factors we don't know. One solution doesn't fit all for everybody, but I think we can always find something we can build upon when we work together. And again, we'll share some resources at the end about how to adapt, locate and adapt resources to fit needs best. Next slide. And this reference at the bottom here is really excellent. It applies to the last slide and this slide too, about where and from whom do parents get information on child development behavior, a variety of sources. And I kind of honed in on number 2 is medical providers are a trusted source, because I'm a medical provider, but you all may be from other categories, and I bet you'll find yourself on here somewhere, whether you're a friend or family member for a particular child and family, or another type of professional. Parents are seeking good, solid information, and it is meaningful. We can do that in a way that really connects with them. What I am interested in for the rest of this reference at the bottom is that hurried explanations of positive and negative reinforcement do not effectively change parenting practices. It's really tempting to just say quickly, one quick tip, but think about as we go and as you have your clinical daily life, did that quick tip connect with what the parent needed? And from there, I will say next slide. Dr. Vose is going to give us some background first, and I will see you a bit later. Dr. Vose, take it away.
Thanks, Dr. Whitaker. So when we're talking about parents, let's define that. So when we're saying parents in this presentation, we're talking about caregivers that could be the biological parents, could be adoptive parents, could be grandparents, foster parents, single parents, older siblings, other relatives. So anyone who plays a meaningful role in the kiddo's life, we're going to call a parent here. And we'll apply that to this definition. So positive parenting is defined as a continual relationship of a parent and child or children that includes caring, teaching, leading, communicating, and providing for the needs of the child consistently and unconditionally. Next slide. So there is a lot of research out there about the benefits of using positive parenting strategies. And so here's just a few that I picked out for this presentation, but improved attachment and security among toddlers, improved school adjustment among children, long-term reductions in behavior problems among children, increased compliance and self-regulation in children, improved ability to resist negative peer influences among adolescents, and lower dysfunctional parenting styles and higher sense of empowerment or parenting competence, excuse me. So it's for both parents and children here that the benefits happen. Some additional benefits include, and this is going to be a long list as well, this is everywhere, but increased compliance, greater cognitive skills, more school readiness, less negativity, more willingness to try new things, better cognitive and social development, better language development, better conversational skills, and less antisocial behavior. So based on the research, we've hit almost every aspect of a kiddo's life and parents' lives as well. So positive parenting can be beneficial everywhere. Next slide, please. So we're just going to go over a few positive parenting practices to give a foundation before we apply this to our clinical activities. And so these are all coming from the CDC's Essentials for Parenting Toddlers and Preschoolers. And this is its own site, and you can Google just that, CDC Essentials for Parenting and Toddlers, and it will bring up all of the resources and information that I'm talking about. And so we just wanted to hit on a few. And so we're going to hit on communicating with children, giving directions, and using consequences. However, this resource also has using timeout and creating structure and rules, as well as videos and quick tips and how to troubleshoot things when they go wrong. So we're hitting on a small chunk. There are also other positive parenting practices out there that are not listed on the CDC's resource that could also be helpful. These are the main ones that we wanted to hit on. Next slide, please. So the first one, communicating with children. Here's 3 quick tips, and we'll go into detail for these. Good communication between parents and children is important for developing their relationship, also for developing any relationship that a kiddo has. So that could be a teacher, a clinician. Good communication aids that. As children get older and into adolescence and adulthood, good communication will make it easier to talk about difficult topics. And talking about adolescence with good decision making, not using alcohol and drugs, and those kind of heavy topics that we need to talk about. So the first way parents or you as a clinician can communicate is praising the child when they do something right. The more you praise a behavior, the more likely the kiddo is going to behave in that way again. And this just comes from that behavioral principle of reinforcement. We use that word so much, but I think I like praise more for a nice parent-friendly way to say that. Praise your kiddo. We mostly know what that means. The second is pay attention to what the child is trying to communicate. Giving the child full attention will help you understand what they're trying to tell you, but it will also make the child feel like you care and want to understand what they're saying. The third is set aside time each day to talk and play with a child. Special time is so important. It strengthens the bond between parent and child. It also fills the child's attention bucket. So we all want attention. We all want to engage. And so if you fill that up for the kiddo, it will decrease problem behaviors later when they're trying to get your attention. So we're going to look at these 3 in more detail. Next slide, please. So responding to behavior. Like I was saying, attention is so important, and children demand a lot of attention, especially toddlers and preschoolers. They like the most attention. And attention can either be positive or it can be negative. So it can be hugs and kisses and saying nice and sweet things, or it can be negative where you're correcting, yelling, scolding, those kind of things. So there's two things to remember about attention. First is any attention, positive or negative, that your kiddo receives or any kiddo receives right after the behavior increases the chance that that behavior is going to happen again. Reinforcement. The other little tip to this is that kiddos really don't differentiate between positive and negative attention. They just see attention and they like attention. So keep that in mind. The second part is that negative attention becomes a problem when you use it more than positive attention. There is a time and a place that you need negative attention. You have to sometimes correct problems. Sometimes you just get frustrated yourself. So we're all humans, adults make mistakes too. But there is a time for negative attention. But it's a problem when that's happening more than the positive attention is happening. And it's really an easy trap to fall into as well, right? You can say, no, stop, and kind of just get frustrated. But changing how that happens is really important. So we're going to focus all on the positive attention piece. And one way to do that is to praise. So praise is providing attention for something that you like, and it can be so tiny. Thank you for sitting in your seat. Thank you for picking that up, that piece of paper up for me. Little things. It doesn't have to be anything big or exciting. It can be very simple. So praise works because it increases the desired behavior. It lets the child know what you like about what they did. And that will increase their self-esteem, and it adds to the warmth of the relationship. I don't know about you, but when somebody says, thank you for doing that, or praises something that I do, I get a little warm feeling, and you're like, yeah, I got this. Praise should be specific. It should be labeled. It can just be very general, right? It can just be unlabeled, and it can be great job, super, way to go. And that will show you approval and affection, but it doesn't tell a kiddo or a person what you liked about their behavior, or how to do that again to get the praise. Labeled praise is so important because it tells the kiddo exactly what you liked, right? So what a great job of putting away your toys. Every parent wants kids to pick up toys, right? There's always toys somewhere. Or you did a super job making your bed. Giving them exactly what you like is the key there. Labeled praise is also best when it's not expected, when it's kind of random and the kiddo is doing something that you like. I don't know about you, but I've heard a few times parents are like, they don't do anything that I can praise. There's nothing, they're not doing anything right. I can't praise them. And there is always something that a kiddo is doing that you can praise. Even in a tantrum, there's something. The kiddo might have stopped kicking you. Thank you for having safe feet. Great, we can praise that. Or, their voice just went calm and quiet. Praise that. There is always something little. But parents might need to be taught how to look for those things. And so you might have to teach them to look at the opposite of the challenging behavior and go for that. We know he's crying and screaming right now. Well, let's praise him when he's using a great tone of voice. So coaching parents to look for those those pieces. And for yourself as clinicians, it's sometimes hard. You're like, they're not doing anything. What do I praise? There's something. You just have to keep looking for it. Another way to respond to behavior in a positive way and provide positive attention is through imitation. So copying or mimicking what the child is doing. So if they're playing with blocks on the floor, that means you get on the floor and you build the blocks the same way that the kiddo is doing. This makes the kiddo feel good about themselves. It teaches them how to play with other people, play next to and play differently. And it also tends to increase the child's imitation of what the parent does as well. So now they're looking to others to see what they're doing and imitating that. And so this is where social learning is coming into play. And that's really how kids learn, is through their social environment, seeing what other people do. Adults do this as well, and we do this subconsciously. So if you are sitting there talking with someone else and you lean in, or you cross your arms or tilt your head to the side, the person that you're talking to is going to do the exact same thing. This is just a natural thing that happens, and a great way to provide attention for a kiddo. Last one here is description. So this is where you describe what the kiddo is doing in as much detail as possible. I like to think of this as like Morgan Freeman's voice in my head, narrating the movie as we're going on. Or if you're into sports, think about a sportscaster, what they're doing for the audience. That's what needs to happen for the kiddo. You're describing everything that happens here. This allows the kiddo to lead the play, gives them a little bit of control. They know what's going on. It shows the child that you're interested, or the parent's interested. It models speech as well. So you're going to be using language, or the parent's going to be using language that the kiddo might not have yet in their vocabulary. It's going to give them more ways to think about their play and to use later on. It also holds the child's attention to the play. And so this will increase the length of time that the child's able to sit at a task, which prepares them to focus for school. I don't know, I'm a psychologist, so I often hear they don't pay attention for very long. It's like 1 to 2 seconds. Well, describe what they're doing. See if that will hold their attention or expand attention a little longer. It also organizes a kiddo's thoughts about play and what's going on, and creating a storyline or just some structure to that, and an early executive functioning skill that is being taught here. That's the providing good attention for responding to behaviors. Next slide, please. Another way to respond to behavior and provide positive communication is active listening. And so this, in active listening, you're getting on your kiddo's level, you're making eye contact, and you're reflecting back what they're saying. So this is letting the kiddo know that you're interested in what they have to say, and allows them to feel comfortable to say those things. So it can be really easy to kind of brush off what kids are saying, right? They talk a lot. And so things happen where parents are just busy, and it's hard to stop and put everything down and listen. But when you do listen and really get to the point of it, you get some just great interactions. So when you're reflecting back, one way is to just say what they said, and you can add on to it. You can kind of correct it if there's some grammatical errors. You don't have to repeat everything, but it needs to be pretty similar. And when you do this, you are allowing the kiddo the chance to keep talking, right? You're going to increase the likelihood that they keep telling you what's going on. Same for emotions. So when you reflect back emotions, you're teaching your kiddo that it's okay to talk about emotions, and it's okay to have those emotions. And you're going to give them more ways to talk about emotions when you're reflecting those back. Kiddos might not know what they're feeling, but you can add that in. I see that you're upset. Or, oh, it looks like you're upset because Johnny took your toy. Oh, that's a bummer. And kind of helping kids problem solve through those things. For active listening, you may not be sure what's going on sometimes, but take a guess. And you might not get it right, and that's okay. Kiddos are usually going to correct you and say, no, it's this instead. And that's just a time to figure out what's going on for them. Next slide, please. Another way to give great attention is special time. This is this last piece of communicating. And this is one of my favorite go-tos is special time. So one way parents can really build that relationship, and one of the ways that they can change and have some more positive parenting is special time. And so parents already spend a lot of time with their kiddos, right? There's a lot of time that goes into taking care of kiddos. However, there's a difference here. This isn't casual time or time at dinner or bathing or those kind of activities of daily living. This is scheduled special time where the kiddo gets to lead the play. It's a joint activity, but the kiddo gets to decide what it is and how it works. So you're going to use all of the strategies that we just talked about: praise, imitation, description, active listening during that time. And parents really need to be enthusiastic, or caregivers, whoever, be enthusiastic and have fun. It's time where this kiddo, you're solely dedicated to them. You're limiting questions, directions, and criticisms, because when you do those things, when you ask questions or you give direction, you're taking over the lead and the kiddo doesn't have that anymore. So try to limit those as much as possible. And when we add in criticisms, we might actually do the reverse of what we want to do, and that might lower the child's self-esteem, and it creates an unpleasant interaction. With this, we want to build up that interaction. We want to create a strong interaction and relationship for the kiddo. Ignore minor misbehaviors here. So if the kiddo is doing something that you really don't like, but they're still safe, they're not hurting themselves or others, ignore it and go back to what you can praise and what you like to see there. This time should be given every day, is the best way for it to happen. And kiddos really strive for that. For younger kiddos, every day works. And it's never dependent upon if the kiddo is behaving bad or is having a tough day, and it's never taken away as punishment. This is a time non-contingent upon behavior for just some good special time. And if they are having a bad day, I would bet that this will turn it around. They're going to get good attention. They're going to get everything that they're wanting from parents. So special time is beneficial for the kiddo, but it's also beneficial for the parent as well. So the kiddo feels a sense of connection when they can count on special time every day. It decreases their need to misbehave, or just because you're getting good attention, you're filling up their bucket. Scheduled time for parents is also a reminder for why they had children. What's the joy and the fun in having kiddos? You get to play with them and engage with them. And a key here is when parents are busy and their child is coming up and saying, mommy, mommy, or daddy, daddy, and just wanting something, parents can say, you know, right now I can't, I'm doing something, but I'm really looking forward to our special time at 4:30. We can play then. So having things to do having that special time can kind of get around some misbehaviors or some problem behaviors or attention seeking behaviors. So special time really is for younger kiddos. So kiddos before 2 years of age need a lot more than 5 to 10 minutes of special time a day, but from about 2 to 6, at least 10 minutes a day. I know most people could find 10 minutes somewhere in their day. Most parents could find 10 minutes to do. So 2 to 6, 10 minutes is great. From 6 to 12, kiddos might not need special time every day, but they need about half an hour a week. So it could mean banking all the time and finding 30 minutes one day a week that's special time. And don't be fooled, teenagers want this too. So in adolescence, friends are more important than family, but special time that's dedicated to them from parents is also very key for relationship development. And they might act like they don't want it, but find something that teenager is into, and then you'll have special time. Last piece on this is be consistent. The most important part is that the child knows exactly when they can count on time, and that time has been set aside specifically for them. Next slide, please. Just shift a little bit to a new topic, but another great way that parents can use some positive parenting strategies, and that's giving good directions. And so I don't know how many times a day parents have to give directions, but if you use this model, maybe not to the T every time, but pretty close, you'll get more compliance with directions. I hear my child doesn't listen, I have to keep repeating it. It's a fight to get them to do what I ask. Go back to these principles and make sure that we have good giving direction skills. And so the positive relationship is the most important part for getting kiddos to listen and to follow directions is key. So doing all of the things we were just talking about, plus giving directions in an essential manner just helps that happen. So good directions can also impact the interactions daily and how kiddos behave. So when you're giving good directions, tell your kiddo exactly what you want. Instead of saying, stop, quit, don't do that, tell them exactly what you want them to do. So kiddos running through the house and you say, stop. They don't know what to stop. But if you say, please walk instead of run in the house, you're telling them exactly what you want. So there's really no argument when you say that way. Say it that way, right? For older kiddos. Good directions can also prevent misbehaviors. So you see a kiddo is about to do something that you don't want to, like throw a toy. You could jump right in and say, please put the toy on the floor gently. And then that lets your kiddo know exactly what you want them to do. Other piece is anytime you give a direction, use a consequence. Thank you for doing that. Positive praise, or you might have to use a negative consequence if the kiddo doesn't follow through. And we'll hit on consequences next slide. So let's go through the good 4 steps to giving good directions. Go back a slide real quick. Thank you. Giving good directions. Get on the kiddo's level. You need to get their attention. So if you're across the room, come close to the kiddo. If your back's turned to the kiddo, do that. I always remember my mom like screaming through the house right? If you're on another floor, it's going to be hard to give a good direction. But when my mom came to me, then I understood what she was asking. So make sure you're on their level. Eye level is always best. Doesn't always happen though. Second is give the direction. Make sure first it fits the kiddo's age. We're all here know about what's developmentally appropriate, right? We can't ask a kiddo to do something that they can't do or is outside of their zone of proximal development. The second is be specific. Tell them exactly what you want. Avoid saying be good or straighten up or be nice or those kind of statements, because kiddos may not know what you're asking and they might interpret those differently than what you were expecting. So tell them exactly what you want. Usually it's just the opposite of the misbehavior, right? So instead of saying, stop jumping, feet on the floor, please. Simple, just turn it around a little bit. Second, make it a statement. So tell your child rather than asking. When you ask, you give them the time to just jump out of it. So they could say no. And then use it in a neutral tone. 3, check for compliance. Make sure you they understand what you ask. And then 4, have a consequence. Then next slide, please. Using consequences, they can be positive or negative. So praise what you want to see. And then sometimes you do need to use negative consequences. And so I won't go into detail here, but here's a few that you could use. Start with ignoring distraction. And then if it keeps escalating, go to your other ones. Next slide, please. So here's a quick video that we're going to play. I want you to look for what opportunities did these parents miss, and feel free to pop them into the chat as you see them.
Like a snake. You see it? It's an S. So we have S and B. Look here. Oh, I love this one. N. You say it. N. N. Good. Look, Mommy. Oh, that's great, honey. Now go pick up that stuff in the hallway and put it back in the thing. You know, the big green one. Thanks.
I see some coming in now. So while you're throwing those in, Dr. Whitaker is going to take back over. I think you might be on mute, Dr. Whitaker.
Because I'm always on mute. Okay, sorry. Yes, this is a perfect slide. So thank you, Dr. Vose, for giving us that great foundation of the sorts of ways parents can interact. And now I'm going to try to tag in. She had such good examples already. I'll try to tag in to that clinical role. And so just kind of think back to some of the ones she had. I think we, as a medical clinician or other professionals, as you are doing your work, we have powers I don't think we always use to the best degree. And I mentioned before, I think we can make tiny moments in our clinical interactions really meaningful to help the parents in brief ways. Dr. Vose gave very nice examples and lots of specific advice. But I also think we can do some of those things fairly quickly. So here are the examples I promised before. I'm going to model for parents as I interact with their children how I want all kids to be treated, with respect and being positive and showing them sort of the next thing. And as I do that, I think I'm modeling for the parents as well. Sometimes the parents model for me, and I can learn from that as well. I also caution, and I teach a lot of physicians in training, medical students. I caution them that sometimes the things we don't say or the careless remarks we make can make a meaningful impression on families as well. Even back to those positive words. If there's a time when I don't use the most positive word, maybe I've missed a chance to be a positive role model in that circumstance. So think about careless remarks, or think about those opportunities. And sometimes it is okay not to comment on every single behavior that goes on, but be aware that families may interpret that as permission. So if something really problematic happens within a visit with me, and I don't make at least some sort of comment, whether I'm gently redirecting or somewhat more than that, it may seem that I'm okay with whatever it is. And so if it's a mild behavior that's not hurting anybody, that's one thing. But if it is something more significant, I need to think about what my lack of response might say as well. So in terms of using my clinical powers, I want to encourage the parent powers. Next slide. I also think a lot as a developmental pediatrician about how developmental factors are intertwined. I will give you some resources quickly at the end, but I will also be flashing up some slides about developmental moments we can help parents notice. So I think I'm a teacher all day long, just when I'm making these connections for families, because it doesn't come so naturally to everybody. So I'll put the little star sign here when we're recognizing a developmental moment. Next slide. So our powers of observation can help families. I think first here about child's temperament, and again, back to my positive word. So we're all kind of born with, nature versus nurture. I won't go too deep here, but I think we're born with sort of a temperament, and that is shaped every day by all of our experiences. And when we use and think about those positive words, sociability, activity level, emotional intensity, reactivity, persistence, frustration, tolerance, those temperament characteristics, we further shape expectations of the family and the family of their child when they use them. And it's not always necessary to think about changing the entire characteristic of the child, but to support that child as needed. We all are kind of different. And again, if we know more about child development, we can have these fit very nicely to what the child's level is ready for. Tuning in general to the child's perspective is very helpful. It keeps things sort of smooth, and it supports them in their own growth. Next slide. So a couple of examples. In temperament, in thinking about emotional intensity, reactivity, I think first about the positive words, to think about emotions, but not to use words like dramatic or throws a fit. Those are kind of negative. So if I hear parents say some of those words, I'll just rephrase to some more positive word. I think, and also that things like intensity can be great. If you have maximum delight and joy when something great is going on, that's wonderful. But it also may be that you get really excited and upset if something goes wrong. So an example could be if a child throws a tantrum in the office after a toy is taken away, we can calmly model redirection. We can mention to the parents, again, calmly, that such intense feelings might be hard for the child, and maybe we can help. As Dr. Vose mentioned earlier, I can see you seem upset. Well, but we need to move on. So we'll do this next thing. And then they can distract to something else. So in my world, that could be moving to the next testing item or another activity we need to do. But calm redirection can be really appropriate for us to do. And sometimes that's helpful for the families if they've not thought about it before, in having that example in front of them. Frustration tolerance. Again, frustration can be talked about negatively, but I think it's nice to claim every positive thing about when a baby gets over it. For example, baby doesn't like tummy time. We, as developmental folks, know that tummy time is important to build your muscles and get a different view of the world. And in this case, we could encourage by doing an example for the family. Even if the baby's calm for a moment on tummy, we can praise that and hug and smooth their skin and be really gentle and make sure they're getting, even for a baby, really positive reinforcement. So one of my points here is starts really early. You don't have to be a toddler to think through what these positives could mean. And little bits matter, and incremental changes can be helpful. Next slide. So 4 months, just another example of how young babies can have emotions. They show you happy or sad, a developmental milestone. Next slide. More temperament and personality. When I think about activity level, I often caution my trainees, students, and residents, don't agree with words like hyperactive too frivolously, and think about that in developmental norms for the child's level. I like to try to use, as positive words as I can. Think about energy level, or, oh, he's quite active, but look at what we're doing together now, or, phrase that in a way that it's viewed positive from the start. I'll mention sociability just briefly. This is a time, again, to use positive words, things like shy. Some people call a negative word, some people don't. But if we notice some of those type of characteristics, we can provide help to address that and show the child some options they have. I don't think we need to make everyone an extrovert necessarily, but show a child who's anxious or cautious about things ways they can move to the next level to perhaps enjoy something else. In coping with change, transition, that's okay, we can go ahead. I like to think of providing a transition, and you can call that a warning to the next segment. That allows families to see that we need to prepare kids when there are changes coming up. If kids don't like change, it's especially important to give that transition time or warning. 18 months, for example, about temperament and shyness. An 18-month-old, developmentally, it's appropriate for them to be aware of new situations, and developmentally, I would then say to the family, look, she's aware that this is different. That's great. Now let's help her move to the next step. Next slide. Power of attention. Dr. Vose covered this very well, so I'll skip right to the example here. We want to positively pay attention so that the child feels heard and appreciated. What I look for in visits, if there is a misbehavior that is dominating everything, I look really hard for the one thing that's not that misbehavior or the series of misbehaviors. I agree wholeheartedly with Dr. Vose. There's something there that's a positive. And even if it's a pause, we have to find it. So I often will walk families through exactly like, look, I'm having a little bit of trouble catching a break in his behavior, but what I'm going to do is find the one moment where he's paused. And this shows them exactly how they can do the same sort of coping at home for themselves. And then if you call it to the attention of the child and the parent together, the child and the parent can work on it together. So as the child ages, that child can then be in charge of doing some of those, noticing my calm moment sorts of things on their own. And again, I mentioned before, doing some of this proactively helps you save time. If you're a professional and you have a busy schedule, if you notice some of these things and make those connections early and proactively, you save yourself some time in the long run, I think. Next slide. Power of praise. Dr. Vose covered this so beautifully. I'm going to skip by to the next slide. And here we have an opportunity for praise. Let's say this little guy splashes water everywhere, but what he did was he tried to wash his hands. So we find the moments where he's trying and making new developmental progress that we can praise and say we're proud of. And then we can toss in, and next time we'll wipe up the splashes together. It's okay. Next slide. Power of active listening, Dr. Vose also covered very well. I'll get straight to the example. In a medical clinic, I get a history, get some information. I always make sure, even for little kids, and it depends on the kid, but even little ones can chime in. They can be part of their own story. It doesn't have to be all about the parents. The older the child gets, the more important it is for them to be the primary person who does a lot of the talking and not just the parent. I think it's important that the child feel heard both from a professional, and it models for the parents that that's what we expect for the child to gain that independence over time. So when I actively ask and then actively listen and comment back to a child's concerns or comments, or even if they don't have a lot to say, that shows them respect, and it models that again for the family. Next slide. Offering choices is very easy to do. I think the magic there is to know which choices you want. In a medical visit, I might say, which ear shall I check first? In general, whether you're offering choices of a medical exam or you're at the grocery store, you want to give a tip to the parents to increase the nutritional range, let the child do some choosing, be sure to set up the choices the way you want them to go. So if you only want a few things to be chosen from, set it up that way from the beginning. And caution, don't set it up as a yes, no. If I need to look at a child's ears for an exam, I can't say yes or no questions. I need to phrase it as, I'm going to look at your ear, which one shall I check first? Instead of, do you want me to look at your ears? Because then if the answer is no, I'm in trouble. So in order to continue to respect that, I have to give him choices I'm okay with. Next slide. Power of play. We've discussed that a lot. I'm going to get to the resources fairly quickly. So let me skip this one. Next slide, please. And I'll flip through some slides about development really quickly. Again, just really important, connect these tips back to developmental things the family can see. When families see developmental things unfold before their very eyes, they are much more likely to notice and encourage them going forward. So I like to give good resources. I'll flip through a few of these slides and then show you where I got them. So we'll end close to on time. Next slide. 4 years, nice imitation. Next slide. And again, those factors are intertwined. Let me go another slide and get to the resources. Next slide. Next slide. Next slide. I said this basically. I'll tell this while I say the next one. Okay, these are great resources, and I'll tell some of the ones we skipped. I think it's really important to have families do a lot of the monitoring of developmental progress in a well child check with a physician or a clinician. We want to get screenings done. We want to talk about this specifically, but every day the family can watch what's going on with their child. If they have really great resources where they can get good lists of what to look for, not just the list of what to look for, but tips about things they can do, that's really helpful. This is not the only resource in the world that is great, but the Centers for Disease Control and Prevention, or CDC, has the Learn the Signs Act Early program with a free milestone tracker app you can put on your phone. They have lots of other resources on their website. It's really great to be able to promote to families things they can do to be engaged. I think it all comes back to behavior as well, because if a family's really empowered to know what to look for developmentally, they'll know some of the behaviors that match in that same realm. So if you have a 4-year-old, but you're expecting them to do 6-year-old things, it's probably going to be some disappointment. So we want to help them figure out where the child is. For kids who are a little off track, may have some delays, we'll have to help more specifically. Next slide. Just a next slide, just a better version of that. Also on the website are some other, the pictures I got, and there are videos that match a lot of the milestones, are very nicely present on the website and the app. So if you have other trainees you need to show them to, this is a great place to get them. Next slide. Next slide. This just goes on a little bit. As a matter of fact, I think we'll end here. It's right at 2 o'clock. I'll say that on the slides, when those get distributed, I have some more things on reading. Dr. Class talked about that this morning, and these resources go on a little bit, but basically more things to encourage development. So rather than click them through, I'll just end and let David wrap us up because I know we're at time. But there are a few more resources on the slides if you pick them later. Thank you all for your attention.
Well, that was wonderful. Thank you both so much. We want to thank all of the participants today. We hope that you got as much out of it as we all did, and hope that it was exactly what you were looking for. To answer a question or two, ICS will be providing a recording of this session to all of the attendees. You'll be getting a notice in your email next week about that. That would be the same thing, I believe, about the PowerPoint slides. So that should take care of it. Again, we thank you all so much for attending, especially our presenters. Looking at the comments, all of the questions were answered. You guys did a great job with that, especially promoting the discussion. And from my perspective, that video was a valuable tool for doing that. So thank you all so much. We hope that you all have enjoyed the Nurturing Developing Minds conference. I know I have. I've learned something every year and every session that I'm have the opportunity to see. So Doctors Whitaker and Vose, thank you again. And we thank you for the work you do. And we hope you all have a great day.